Another common orthopedic treatment modality is the use of injections around joints or tendons, and there are a number of agents that we will consider injecting. A very common one in orthopedics has been the use of corticosteroids, which are anti-inflammatory steroids, with the goal being pain relief and kind of control of inflammation. Probably the best use of these agents is in arthritic conditions when arthritis is more advanced. We're really trying to put off the need for a joint replacement, but they have other applications as well. Non-steroidal anti-inflammatories, particularly an injectable called ketorolac, can also be used in a number of conditions as well for a non-steroidal anti-inflammatory approach, and in many cases can offer some similar relief. Common treatment for knee arthritis is what we commonly refer to as gel injections or hyaluronic acid, which is a concentration of a normal substance that is part of the lubricant component of knee joint fluid. So typically indicated for knee joint arthritis, although can be utilized off-label in other joints. Finally, what's kind of increasingly common we're getting questions about is the use of biologic agents like platelet-rich plasma, bone marrow or adipose stem cells, or injectable amnion or donor products. And these are probably going to see an increased role in the orthopedic world in the future, but something that we can discuss more and offer today.